everyone, Academic Doc here and welcome back to the channel. If you're new here, my name is Leher and I'm a clinical academic doctor working in the UK. Today's video is all about communication skills. This is useful for anyone sitting medical school or postgraduate exams or more generally on the wards. I'll be talking you through how you can approach the communication skills scenario. I also have some videos on more specific communication skills stations if you're interested. I'll leave the links to these down in the description below. Communication skills stations are an easy way to secure those top marks, provided you have a structured approach and practice them. Having a structure to these scenarios can make sure you don't miss any critical points, particularly when the nerves are high. In general, I like to think of communication skills stations like the shape of a diamond. You start off with very specific questions at the narrow part, then build up to the main information giving section, and then narrow back down by summarising at the end and offering the opportunity to ask any questions. In the first part of this video, I'll be sharing some tips and tricks that you can use in your preparation. When preparing for the exam, I find it really helpful to memorise some standard phrases which I can then adapt to any scenario. This is a useful strategy, particularly if it's a difficult conversation or a scenario that you're not familiar with. Some common phrases that are really empathetic and I find them useful are, "I can see that this is very difficult for you," or "I can see that this is not the news that you were expecting. Is there anything I can do to help or support you in this process?" My second tip is to focus on common themes. Medical schools and postgraduate exams tend to have some common themes to the communication skills stations. Here is a list of some of them. The key themes tend to revolve around explaining a new diagnosis, breaking bad news, end of life or resuscitation discussions, discussions around feeding, duty of candour, breaking confidentiality, genetic counselling, consenting for a procedure, and counselling about medications or lifestyle changes. This is not an exhaustive list, but it gives you a general overview of what to expect on the day. My third tip is to be wary of scenarios, particularly those with a hidden agenda. These tend to be the more difficult conversations, particularly around feeding or end-of-life care. So unless you explore certain concepts within the station, the patient will not bring them up, and you could risk missing vital marks. My fourth tip is to practice, practice, practice. They do say practicing makes you perfect. I'd recommend practicing each of those scenarios for different specialties so that you're prepared for anything on the exam day. Find yourself a study partner and try and practice and meet up with them regularly. If you're at uni or you live alone and you don't have a study partner, don't worry. You can even practice by calling your parents on the phone. I'd recommend giving yourself a solid 2 or 3 months to practice before the exam. My fifth and final tip, and probably one of the most important, is to talk about the impact. This is something I've seen that a lot of candidates overlook. Talking about the impact of the condition and safety netting is a really key part of summarising and ending your scenario. This is relevant for all communication skills scenarios, but in particular when you've got a scenario around epilepsy or diabetes, as it can have legal implications. Key things to consider when you're talking about the impact of a condition is discussions around driving, implications for high-risk activities, day-to-day modifications to their job, and fertility. If you're counselling patients on, let's say, diabetes, you can also use this section to explore any other risk factors and how they can modify them to try and reduce their risk. This might be things around dietary changes, portion sizes, exercise, or general lifestyle advice. This is a really easy way to impress the examiners and also show that you empathise with the patient to try and secure those top marks. In the next part of the video, I wanted to share some useful tips and tricks that you can use on the exam day. You'll have plenty of time to read the scenario before the station starts. I find it helpful to use this time to jot down any key points that I don't want to miss after going into the station. These might be things like exploring key symptoms, explaining the diagnosis, any specific treatments that you want to discuss, implications of the diagnosis, safety netting, and never forget ICE. When you enter the station, start by introducing yourself and explaining the reason for the consultation today. I like to start by using an open question to really encourage the patient or the actor to speak. One of the things that examiners will really focus on during this scenario is your body language. Try and keep your body language very open and avoid leaning back in the chair, folding your arms, and things like that. The other thing you can really do to show that you're listening to patients is making sure you maintain eye contact during the entire consultation. You can also do simple gestures. For example, if you're breaking bad news, leaning forwards can really show that you're listening to the patient and empathizing with them. At the end of the scenario, it's useful to signpost the patient to other sources of information. This might be a patient information leaflet, the number for the cancer specialist nurse, referencing a website such as Cancer Research UK or NHS website, and if the scenario is about duty of candour or a complaint, you can also give them the number for PALS. That was a quick whistle-stop tour of how to approach the communication skills station in medical school or postgraduate exams. If you did enjoy the video, I'd love to hear about it in the comments section below. I really hope you enjoyed watching the video and found it useful. If you did, please do hit the like and subscribe button to stay up to date with the latest content. Thanks very much for watching, and I'll see you on the next video.